Welcome to the Inspire and Ignite series with Safe States Alliance. Each month, we bring you a two-part series focused on innovations in injury and violence prevention. At the beginning of the month, we release a pre-recorded webinar. You can watch it at any time. Later in the month, we host a facilitated conversation for practitioners to come together and brainstorm opportunities to strengthen the field. For more information about this series this month, use the QR codes at the end of the video. Thanks for watching.
Hi everybody, my name is Taffy Hunter from the Spokane Regional Domestic Violence Coalition. I'm the Executive Director here, and I'm so excited to be here to share with you an update on our Positive Community Norms campaign, which is focused on domestic and youth violence and the prevention of it. So today I'd love to share with you a little bit about why prevention matters to us, what we learned through our pilot program and initial surveys, how we built our Positive Community Norms campaign, what we found after a year of what has worked and what hasn't worked, and what's next for us. I'd love to start off with covering a great prevention story that I really love. I know that we often talk about upriver and downriver and the cows floating in the river story, the prevention river. This one's a little bit different, and I really like it. I want you to think about a family. Say her name is Julie and her children, and she's living her best life with her kids. They're up here on the cliff of good health. They have access to food and housing. They're just living it up, and that's exciting and happy for her. As she is going through life with her children, her husband begins to show some signs of manipulation, maybe some isolation, minimization, some of those things that we see on the power and control wheel that are concerning in relationships. As that happens, her life moves a little bit closer to the edge of the cliff of good health. Now, her community is an amazing community. They've put up a lot of fences, some prevention fences. You know, her family really believe in her. They believe in healthy relationships. Her community as well supports healthy relationships. So they have things in their community where if someone is experiencing harm, they can seek help. Her faith community also supports her. But even with all of this prevention, all of this this work that her community has done, as Julie moves on through her life, she moves closer and closer to that cliff. She unfortunately falls through the fence and falls off the cliff. Some of those prevention factors that her community and family have put into place just weren't able to prevent her from falling off the cliff and experiencing some harm. As she falls, her community surrounds her with some safety net programs, some services, some advocacy, some support, financial support, safety planning. And they really rally around her to help prevent further harm from happening. Unfortunately, Julie experiences further harm. That harm requires her to access some emergency care, to get law enforcement involved, to get the medical facility involved. So she's taken by ambulance to a hospital. She's interviewed by law enforcement. The courts and the protective system is activated for her. And it takes a while for Julie to really work hard to recover both physically, emotionally, mentally, and get her family back to the place where they would consider themselves being back on the top of that cliff of good health. That is really a great story, very illustrative of what happens in many families when somebody experiences domestic violence. We can see this reflected in the social ecological model as well. I won't spend a lot of time on this. I'm sure most of you, being in prevention work, are very familiar with the individual, relationship, community, and societal levels of risk and protective factors. And it goes really side by side with that cliff of good health that I was just talking about. So how does SRDVC use this information in order to create some really positive, focused, upstream, top of the cliff prevention work? A lot of our partners do essential work at the middle and the bottom of the cliff through advocacy and shelter, law enforcement, crisis response. But our role at SRDVC is a little bit different. We are really focusing on that community norm, that societal change of belief systems, strengthening the conditions that prevent violence in the first place, changing those belief systems, digging into relationships and community expectations. And so instead of catching people after they fall or helping them recover from the harm they experience when they fall, we're trying to create more guardrails, more primary prevention opportunities so that fewer people are experiencing any level of harm. We're doing that through shifting social norms, strengthening protective factors, really engaging youth in healthy relationship learning early on, getting our community involved in responsibility taking, and again, preventing that violence before there is a crisis. So we started this work by developing an IRB approved norms survey. This survey was developed online, and it was really exciting to release that survey out to our community. We had a few requirements. We needed folks to be over the age of 18. We really wanted to leverage people's understandings of relationships as adults, and then that would help us reflect and develop this campaign even further for young people and youth. We recruited participants through social media, through direct contact, through tabling and other events. And we made sure that we were incentivizing participation by offering a $10 local merchant gift card, which was very popular, by the way. Some of the questions we asked, I just wanted to share with you here. These questions are formed in two ways. They're formed to ask how you feel when you are reading this survey and answering these questions. And then that same question is asked and asking you to respond how you think most other adults in Spokane County feel about that question. There's no right or wrong answers, and we encourage our participants to choose the response that is closest to their truth. So one of the questions we ask, if a child or young person I know is impacted by violence at home, I want to find ways to support them. And so the respondent would answer that question on a scale, and the largest number of 5 being most likely wanting to help, and a 1 being not wanting to help at all. And then we would ask that same question, but just rephrased a little bit. What do you think other adults in Spokane County would say if they're asked the same question with that same measurement? We asked, if an adult I know is impacted by violence at home, I want to find ways to support them. I would encourage people who are impacted by violence at home to seek support and services. And so that enabled us to really dig into both what do individuals believe about domestic violence in our community, as well as what individuals believe our community as a whole believes about domestic violence. And this is what we found. So when we ask these questions, actual is that individual response. Perceived is the response that they are giving regarding what they think other people will respond. So if an adult I know is impacted by violence at home, I want to find ways to help them. 90% of our community, 90% agreed with this statement that they would want to find ways to support an adult. However, they believed that 50% would want to help others in Spokane. So 50% of adults, only half of our community, we think, would want to help someone who is experiencing domestic violence. We all have a responsibility to end domestic violence. 89% of folks absolutely agreed that we want to end domestic violence and that our whole community has a responsibility to do that. But they thought only 50% of others would believe in that same statement. And down here, I'm just going to skip down to the last one. If a child or young person I know is impacted by violence at home, I want to find ways to support them. And as you can see, 90% of folks agreed with that statement, and 63% perceived that others would also agree with that statement. And so what a Positive Community Norms campaign does is it really puts together some messaging that addresses the gaps in reality. So the gaps between this is what I believe and this is what my community believes. And we were so excited when we saw these results come out. Such strong positive community norms in our community. We just couldn't wait to share that with others. And so we developed our pilot campaign. And we developed it around these factors, these norms that we found already existed within our community. That most people believe domestic violence is never okay. That people want to support survivors. That people feel responsible to step in and help. That we have a strong shared value in Spokane that children deserve safety. And that our community believes that we can work together to prevent domestic violence. So I'm going to race fast forward over our pilot year and talk to you a little bit about what we have been finding as we've been evaluating that pilot Positive Community Norms campaign, as we have shared it throughout our community, and what the feedback and responses are. I want to share with you a little bit about the pivots that we're needing to make, things that are working, that are not working. And so we developed another survey. It was so successful the first time, we decided to do it a second time. And the things that we wanted to measure were awareness of our campaign and materials. Where were you seeing the billboards? Were you seeing brochures? Were you seeing bus benches, PSAs? Where were you coming across campaigns and materials of our positive community norms? We wanted to measure how clear our message and tone was, what the emotional response was to our messaging. Did people feel positive and hopeful and supported, or misunderstood maybe? We wanted to find out if our messaging was sticking in their brain, if it was relatable, if it was something that they would think about, where they saw the campaign. And we wanted to provide our community an opportunity for feedback, to give us ideas for improvement and for reach. So we did exactly that. These are the 6 campaigns that we put together for our pilot year. And again, we wanted to measure those 4 concepts of understandable, positive, eye-catching, and attractive. I won't read each of these statistics to you, but I will tell you that it really surprised our community, to see these messages as they were being rolled out onto billboards and other areas, social media, for them to see. As we have done this follow-up survey asking about these 4 measurable concepts, we've been able to see which of these messages have been the most successful in resonating in our community and which ones have been the least successful in resonating with our community. And so it's been interesting to see that numbers 3, 5, and 6 have been the most widely accepted, and of course we can see that number 1 has been the least accepted and positive and eye-catching. So our analyst was able to go through the answers that we've received on the survey so far. Now the survey's not closed yet, so these numbers might change. They're still fluid, but what we're seeing preliminarily, she was able to go through and put together these ratings. These ratings are from a 1 to 5, 5 being the best, most impactful across those 4 pieces of measurement. What you may notice, and just as a review from last time we shared our positive community norms with you, what you may notice is that our positive community norms is really positive, right? The colors are vibrant, the smiles are wide and bright and beautiful. We're showing positive family relationships, positive relationships with others. And that was actually some of the feedback we got that was a little bit hard for our community to take. We also wanted to ask about our tagline. Here at the bottom of this one, you can see our commitment, their future. This is a tagline that our team chose without the input of our community. And so we wanted to ask our community, what do you think? What do you think of this tagline? And what do you think of these other ones that we had also considered? We found out that Spokane would prefer listen, believe, support. And they felt that listen, believe, support really connected with the messaging of the community norms campaign that we had put together better than our commitment, their future. So as we're moving forward beyond our pilot year into our next rendition of our PCN, we're strongly thinking about switching our tagline from our commitment, their future to listen, believe, support. Some other areas of improvement that Spokane residents were able to share with us were stronger calls to action. They really wanted to know how to help. What were the next steps? It's great to know that our community supports, but how do they support? And so they wanted our messages to be a little bit more actionable, and that was great feedback. We were really happy to receive that feedback and are working hard to make that happen. Our community also felt that some of these messages were a little bit wordy, and they wanted the messaging to be a little bit easier to read, especially when you're driving past a billboard. And that's valid, you know. And so we're looking at ways to shorten these messages and make them a little bit easier to read, faster to read and digest. I've already hinted at the fact that these messages didn't really resonate equally with everyone. And so what's interesting there is that the feedback we're getting is a little bit of cognitive dissonance, I think. Folks are used to seeing domestic violence campaigns with black eyes and bloody noses, or at least with the threat of that dark, really expressing what it is to live through domestic violence. And it has taken our community a little bit of work to be able to see and experience and resonate with these happier thoughts, happier pictures, brighter colors, positive messaging around domestic violence. And some of the impact that, or some of the feedback that we've received is literally, this is not what domestic violence looks like. And they're right. This is not what domestic violence looks like. This is what positive, healthy relationships look like. And this is what we know Spokane wants our families to look like. So that was pretty interesting. We are also reaching out more broadly to men and male identifying folks to give us some feedback. We've had a lot of demographically self-identified female and women. And so we're needing a little bit more balance there for our representation. And then again, that campaign naming, really people love the listen, believe, support. The norms that we found in our community were so strong that we're going to continue to work with these same norms. We didn't feel like we needed to remeasure norms and find new ones. We really feel like we need to just adjust our campaign a little bit. to help people really understand, make the connections a little bit more strongly, to start resonating with healthy relationships, that domestic violence is preventable, that we can not only prevent it, but we also have a strong support system in our community for that secondary piece, right, when something happens. We're really wanting to focus our community on the fact that our actions, our belief systems, our support systems can help prevent trauma and harm and increase safety and protective factors for families. So I want to reflect back on the cliff of good health that we talked about at the very beginning. SRDVC's work and our partner work with our community members and our coalition members really spans the full prevention continuum. At the top, we build protective norms. Again, this is work that is brand new in this country, protective norms around domestic violence. Positive community norms, around domestic violence has been seen as a best practice for many years, but few have done it. As far as I know, we're the only ones to have done it so far, which is very exciting. The protective factors and norms that our community can embrace is that we do not accept violence, that we feel responsible to act, that we support survivors, that there's a community responsibility to help protect families and children. And so our relationship education helps to focus on those areas. In the middle, we equip systems to identify and respond early to domestic violence concerns. We do that through community education and training, by training our law enforcement and judicial personnel, as well as other systems. We have a conference coming up in March that's intended to provide extensive training to our systems providers here in our region. We have programs like the Handle with Care partnerships with our schools and other school-based identification and support systems. We work in juvenile detention to help prevent further harm from being caused. And we provide our community with referrals and resource navigation so that people know where to turn when things start to go wrong. And finally, we have systems change or tertiary prevention work that SRDVC does. We have firearms relinquishment programs that we partner with direct service organizations as well as our law enforcement organizations. We coordinate legal advocacy. We help with policy change efforts, court watch programs, fatality review panels. We get the whole community involved in that prevention work so that we can identify systems gaps, and it will wrap back up around to the social determinants of health so that we can close those gaps, make our prevention fence a little bit safer so that fewer people can fall through the fence and fall through the net and experience harm and injury. So where are we heading next? This is really, really exciting. We are going to couple those messages that I shared with you with new information, helping our community understand that not only do we support survivors, we support them through free access to legal clinics. We support them through free counseling through our many service providers. We help support domestic violence victims by being willing to talk about domestic violence and putting resources out there in our community that are easily accessible. We want to launch our highest performing campaign materials, those top 3 that I had pointed out previously. We want to make those into more than billboards and social media context and bus benches, but move them into brochures and other important information that's easy to pick up and carry with you. And that falls into expanding our placement across schools and partners and community spaces. We want to continue our youth prevention education. We have an expanded curriculum that is now available to us, and we are in more and more locations to teach healthy relationship classes as time goes on. We are going to continue to track the reach and the engagement of our campaign. And then next year, we're going to re-measure the norms, asking some of those same questions that we had asked previously, and see if there's any norms changes that have happened, any perception changes that have happened. Have we effectively closed the gap in between what we understand we believe and what we think the rest of the community believes about domestic violence, about support, and about the ways that our community can show up to help prevent domestic violence? Thank you all so much for taking the time to listen and to learn a little bit more about the next phases of our Positive Community Norms campaign. We're very excited to move into this upcoming year and to move into that space where we get to start measuring the norms changes. Please feel free to reach out to me if you have any questions, and thank you again. Have a great day, everybody.